Good morning, and thank you for joining PHSA's Return to the Workplace virtual conference. My name is Patricia Clausen, and I'm the Director for the Prevention, Engagement, and Retention for Government, Municipal, and Education sectors at PHSA. I'm pleased to welcome you the No-Playbook Playbook on Pandemic Mental Health Support presentation. Before we begin, I want to mention that there will be an opportunity to answer a few questions following the presentation by Claire and Colin. Please feel free to enter any questions in the chat bar, please, and we will select a few at the end as time permits. We are pleased to welcome Claire Duboc and Colin Anderson to this presentation. Claire is the founder of Mind Beacon Group, a mental health and behavioral health and safety leader that's revolutionizing the access and delivery of evidence-based care. Claire works with organizations across the country to deliver mental health programs with measurable impact and was instrumental in developing Beacon-guided digital therapy. Since launching in 2017, Beacon has helped thousands of Canadians struggling with mental health concerns such as depression, anxiety, PTSD, and insomnia become empowered to live to their fullest potential. Claire was recognized in 2019 by Digital Health Canada with Women Leaders in Digital Health Award for her leadership and impact to digital health in Canada. Colin Anderson is the Executive VP of Beacon, a breakthrough Canadian digital mental health platform that provides customized, progressive-driven, therapist-assisted cognitive behavioral therapy, overcoming barriers of stigma, affordability, and accessibility. Prior to joining Beacon, Colin had a variety of senior positions in the Ontario Public Service, including the Deputy Ministry of Finance, Revenue and Policy, Cabinet Office, Acting Deputy Minister, as well as Associate Deputy Minister of Health and Long-Term Care, Secretary of Treasury Board, and was CEO of Ontario Power Authority. Welcome, Claire and Colin.
Thank you so much, Patricia. That was a wonderful and comprehensive welcome. I have to say, on behalf of Colin and myself, we very much like to thank PSHSA for holding this wonderful event and for allowing us to be part of it. It's going to be a packed day, a great agenda, and we've enjoyed the day so far. It's my first virtual conference, so it's very, very exciting. It reminds me a little of my first days working from home and figuring out a slightly new environment. So thank you very much. I think Patricia gave a really good background for both of us. I would say that you're going to learn hopefully a little bit more than you might already know about Beacon as part of what we speak about today. Specifically, my role at Beacon has been about introducing this new modality, this new approach to therapy to the Canadian private sector, specifically employers and carriers. And it's been a great journey for us through the last 3 years since we first launched it in Canada. We really were focused on offering something new, more choices for people, new ways to access the help that they wanted, and we have seen that employers have been very, very engaged in that conversation. And I think now it's a new future. Colin is going to work with me. I think I'm going to be the voice at the beginning, but Colin, as you heard, has led our public sector efforts during that entire time. And so part of that has been working closely with all levels of government so that they understood where the opportunities for what we were doing, which was offering virtual mental health at a time when there were very few options. And you're going to hear a little bit more as well about what that's led to. What I would suggest, instead of having sort of a formal Q&A at the end, having both Colin and I here offers the opportunity for you to ask questions anytime you'd like throughout the presentation, and Colin's going to monitor that chat function. And he'll just stop and post the questions as they come up, and that way we'll have more of an organic experience. You know, I think that what we do know is that there has been a lot of change in the last couple of months, and that for sure there's been incredible impact on our workplaces as a result of COVID-19. And I think we're hearing a lot of new terms that were not part of our lexicon, things about new normal versus next normal. Remote working has become a very big part of our reality. And I think that behavioral health has also been a even bigger part of the conversation. And I think that Dr. Howitt this morning talked a lot about some really, really important things, and we'd like to continue that conversation. And I guess the reason for the title of this particular session, the No-Playbook Playbook, was in the early days, as we were asked to speak to different groups around mental health and the impact of this pandemic, there was a lot of desire for the answers. What are the answers? And I think what we're all learning in the context of so many things is that there is not a playbook. This is uncharted territories. We're all figuring it out. We certainly can reference things that have happened in the past, but it will be a new future. Next slide. So I just want to, I guess, speak a little bit about our organization. Thanks. Mind Beacon was really, the program really came from our recognition that there were so many barriers for people who were struggling with mental health issues, and that we thought that there was really a need to do things differently, as I mentioned before, to offer more options for people, because we do feel that there is an opportunity for a world of healthier minds, and that leads to better lives. And so we have worked hard to revolutionize the availability, the access, the delivery of effective mental health support and wellness services. And, you know, I would say that we began working with employers to support those in the workplace who are most at risk, really trying to support them to live their best lives in and outside of work. And in 2017, we launched Beacon, which was a new opportunity to access therapy for individuals using computers and their mobile devices. And that has been a discussion that we've had with many organizations, but specifically the organizations over the last years who are really progressive and open about doing things in a new way. And I think that now all organizations have been really challenged to be more open and to be more innovative in everything that we do. And we think that's really an opportunity when we speak about mental health. Next slide. So I think that one of the things that for me is very, very different is that it wasn't very long ago that when I spoke to organizations, I was talking about the 20% or the 1 in 5 employees who are struggling with mental health issues. And I would say the reality is that we all recognize that this has changed. I shared this. I thought it was a very interesting survey that was published. The results were published by McKinsey just about a week ago, a broad survey of over 1,000 employers. And it was really interesting what they found. Of their observations, they realized that 7 out of 10 employers were planning or already taken action in terms of their mental health offerings within their workplace, and that 9 out of 10 recognized that COVID-19 was affecting the behavioral health and the related productivity of their workforce. And that's for sure something that I think that we all recognize. The reality is that everyone's reality changed overnight in March, and that dealing with the related levels of stress has impacted our performance, and it's also put us and our mental health at greater risk. And organizations are recognizing this, and more importantly, they're preparing for this, recognizing that our employees really are our most valued resource, and we need to be focused to support them in a future which really is uncertain. It really is uncertain. And so I think that it's been important that it's not just the employers who are recognizing this, but what we're seeing as well is that our government has recognized it in the way that they have supported us. It has not just been about financial supports, but it has included mental health supports, and we'll talk about that. Next slide. Now, this slide's going to look familiar to you because Dr. Howitt included this slide in his presentation. We also found it was some work that was done by Zunin and Myers. It was in regards to a training manual that was being developed for mental health and human service workers in the US. And I think it's just so impactful to understand what the future is. The reality is that, COVID-19 has been a worldwide crisis, and what began as a medical or an economic crisis is really evolving. And it's described as the echo pandemic. The trailing edge of this program is really going to be around our mental well-being. And I think that this research, as Dr. Howitt outlined, though it was really around some natural disasters, 9/11, events like that were really a moment in time, and what we're going through right now is quite distinctive because it's a period in time. The reality is, I think we all know that the emotional reaction to this event is going to change and evolve, and it's probably helpful for us to think and consider that. As we consider our go forward plan, recognizing that there will be emotional highs and lows over time. And I think as importantly to recognize that it's not going to be a straight line journey, that we will have to accept that there will be challenges over time, different reactions that our employees are going to have as the event evolves. And I don't think I'm going to go through this in detail, but I think that we all intuitively can probably relate to some of the positive impact on our emotions that happened as the pandemic happened. So during April and into May, as we saw the governments react and the workplaces adapt and accommodate to the reality. And I think ahead of us, we are going to see growing challenges. As the optimism that we might be feeling turns more towards discouragement, and the stress that we're all feeling starts to take its toll, and that's when some of our negative emotional reactions are really going to grip in. But we will get over this, and I think that's we will get over this. We will make it through. We are resilient. As humans, we all have a certain amount of resiliency, and I think we have to feel confident that we will make it through, but we can support ourselves to support that process. Next slide. So I think what we heard shortly after the beginning back in the early spring is we heard a lot about this phrase new normal, and now we're hearing a little bit more about the next normal. And I think that in itself is interesting because we don't know what the future will look like. We know that there will be a new future, and we know that there won't be a steady state as we hear about different phases of the pandemic itself, that we as a society and our workplaces are going to have to be reactive to that. And there will be a long period of adaption. And I think that as well, we all recognize that there will be no going back to the way things were. And what's going to be super, super important is resilience, and the resilience of our workforce to be able to adapt and cope with this. The reality is that this situation will change, and the ability for us as individuals to remain calm, to feel a level of acceptance positivity and purpose around this reality is going to be super important. And that this is going to be very important for us in the workplace, because as we are unable to go back to the way things were, and I think there was a lot of great discussion by Dr. Howard on some of the things that will change in the workplace, it's important for us to appreciate that for our employees, this is going to require them to go through incredible personal resilience, because the job that they were hired for is likely to be significantly different in the future. And even amongst the breadth of the organizations that you all work with, each organization has been impacted in unprecedented ways. Some industries have been virtually shut down, while other industries have never been busier. The workplace changed. Now many people are working remotely, and for some people that's very, very uncomfortable for sure, and that's if layoffs have been avoided. And I think the other thing to consider is that many people that had jobs never considered themselves frontline workers, but that's the situation in this unique scenario where individuals who are dealing with the public are now sharing experiences that we traditionally felt were really more only seen in the environment of healthcare workers and first responders. And this is scenarios where people are feeling each day that they go to work that their own well-being might be threatened. Entirely new groups of people. And that's the other fact is that people, as our organizations and as the businesses evolve, people have had to change their roles. And in some cases, they may have been retasked in order to keep their job. And these create incredible levels of stress. I think Dr. Howard also talked about the personal circumstances and the fact that people are working in very different circumstances. Some people are feeling incredible levels of isolation if they happen to be living at home, while others are dealing with the opposite, where all of a sudden their workplace has become extremely crowded by family members, in some cases, young family members that are no longer in daycare and school. And I think it's really important for us to understand that nobody's experience is the same, that everybody has a unique experience that they're trying to adapt to. And we have to understand that. We have to be accommodating and flexible as we allow this, as we move forward. I mentioned before as well about the 20% of the employees that I used to talk about when I worked with organizations. I think that if there was ever a time where we have the opportunity to talk about mental health broadly, now is the time, because I think we each recognize that we are all struggling in our own way to adapt to this new future. And perhaps that's an opportunity. Perhaps that's an opportunity to normalize the conversation around mental health, for us to understand that our mental well-being is really the key to our personal ability to thrive, but also for our organization's ability to thrive. And that's what I wanted to talk about today, some opportunities for that. Can go to the next slide. I think one of the things that we hear a lot about is how do you assess which employees are struggling, and how can you support them? And I think, at the end of the day, that is where we're spending a lot of time, where we have employees working remotely, is trying to figure out how to connect into them in an environment where we don't have the face-to-face meetings or the ability to pick up on the cues that might have been traditionally part of our way of monitoring the workforce. I think the other side of it is because things have changed, I think there is an opportunity for us to show much more empathy and ask the questions that we may not have asked. We may have been just more observant, but taking the time to ask each one of our coworkers how are they doing? And giving people the opportunity to talk and share experiences and recognize that their feelings may be more positive and may evolve over time to less positive, or the alternative, they may find ways of coping. And one of the things that we talk about is the need to really replicate some of the water cooler talk that used to happen in the workplace, the lunchroom talk, creating the unstructured communication. I think we've seen lots of organization adopt the Zoom, the Teams, or the many other various virtual meeting opportunities. And these are really important to make sure that this time isn't all structured and give people a place to be the community that they had at work, to share the stories, to share their issues on a group basis, but as well to find the opportunities individually to open up the discussion and try to identify those that might be struggling and come up with creative ways, not only as managers, as peers, but as organizations, to find new ways for people to adopt to this reality. It might be a creative, or it might be varying the workday so that a family that has young children at home with two working parents can do the home shift, in shift, so that they can both accommodate the work that needs to be done for their workplace. But probably the biggest thing that we can do is offer a safe environment, which really means to recognize that it's okay to not be okay. And it gives people permission, if they're struggling, to self-identify, to look for help, or to ask for things that they feel could help them struggle better or deal better. So I guess really what we talk a little bit about is what that recovery plan looks like in the context of mental health. One of the things that we know is that it's going to have a significant impact over the long term for Canadians. We've certainly seen in our business that those who reach out for help, of course, we've seen a huge increase with organizations that we've worked with over time. But that need and that outreach is growing with time. Health Canada estimates that based on their experience with SARS, that 11 million Canadians will experience high levels of stress, and 2 million Canadians will have traumatic level of stress. And what this means is that each of us have a responsibility in our workplace to look at our methods of supporting our employees and really do an audit to see whether or not our programs are comprehensive enough, whether we have virtual solutions, which are really going to be our part of our future, and most importantly, whether our employees are aware of them and whether they know where to turn and what to access if and when they actually need help.
Hi, Claire. It's Colin. Can you hear me? It's
Sure.
Yeah, you couldn't hear me before, but I was just going to say it's about 10:40, so you might have to speed up a little if we're going to get through all the slides.
Okay.
And to everybody else, I'm posting a poll that you can answer if you go and look in the poll function. So have a look at that. Back to you, Claire.
Thank you, Colin. So I think actually we could go on to the next slide. Yeah, so I think what I spoke to was really around the need in the future to make sure that digital and virtual options for all healthcare are readily available to employees. And I'd like to talk to you about one, if you can move on to the next slide. And that is Beacon, a program that we introduced 3 years ago, which was the first digital mental health therapy program launched in Canada, based on learning that we had gathered from programs that had been introduced in countries around the world. But basically, this is a program that allows individuals to access evidence-based mental health therapy, so specifically cognitive behavioral therapy. It's a program that's guided by a regulated mental health professional, but is available virtually. So working through a digital platform, it allows therapists to work with their clients and allows clients to access their help when and where is convenient for them. So whether that's in the evening after kids have been put to bed, certainly we know that what we need is more options that offer help for employees when and where they want. In the Beacon program, the communication between the client and their therapist is done through secure messaging that is embedded in the platform. But the relationship between the client and their therapist is very, very strong. And in fact, the therapists create a personalized experience for each one of their clients. And it's that personalized experience and the relationship between the two of them that has allowed us to show that, in fact, this is a very effective approach. And if we go on to the next slide, what we've been able to share with our partners in aggregate when we work in the workplace is the results of the program. So showing that, in fact, the course of therapy is able to achieve significant symptom reduction. This shows you in aggregate across our whole course of treatment that 8 out of 10 people have a positive reaction or achieve positive results from the therapy. What you're seeing on the right side is the movement towards the cool colors, which is very, very important, moving people that may be suffering in the more severe levels of moderately or severe into a less severe level of symptomology. Can move on to the next slide. And I think, and maybe Colin, since you're on the line, I'll let you talk about this a little bit, but because this is specifically the work, what has been very important while we were working with organizations and achieving these results is that Colin worked very closely with government to encourage them to look at this new modality, this new approach to therapy, and consider it as part of our public system. Colin, would you like to talk a little bit about the program that you've introduced? Whoops, I think he's perhaps muted. But prior to COVID, Colin worked very closely with public sector partners, and we actually were able to introduce some programs for employees as well as different populations. We've been working with CAMH and Ontario Shores to support their employees as a start. We've also been involved working with students to support campuses across Canada, and that was part of the Mindability program that was announced by Minister Elliott. We work with 6 Toronto area college and university campuses, and we've also been working with Trillium and CAMH to support patients in their mood and anxiety programs. But then COVID arrived, and we've seen we saw the government react very strongly, very quickly, and we're very happy to see them do that. As an organization, one of the first things that we did was add an additional protocol to our program, a health anxiety protocol, recognizing that would be an issue for many people who had real concerns around the pandemic, especially related to the media. As well, we've created programs specifically to support healthcare workers, first responders, and frontline workers. And we are also working with other programs for OPS workers, including correctional workers and parole officers. So that program has started as well. Perhaps one of the most transformational things was on May 5th when the Ontario government announced that they were making available Beacon through the Ontario government COVID support program to every Ontario residents during COVID. So that's something that you, your families, friends can access. Certainly a broad range of mental health supports, including Beacon. And all you have to do is go to the government's Corona support website. If you're a healthcare worker, which some of you are likely today, you can access targeted supports, including Beacon, online therapy by visiting your healthcare worker section of the same website. So that's very exciting to us as well. Next slide.
Claire, just 2 minutes before we move into Q&A.
Okay. So conveniently, I think we're actually at the end. I think I started at the beginning to say that there is no playbook for this. I liken this to parenting. There is no playbook for parenting because each one of our organizations, each of our employees are individuals, and we are undergoing unprecedented times for sure. So all I can say is that there are certain things that we should all be mindful. At the end of the day, we know that we must be flexible, that we need to accommodate as possible as we move forward. I think certainly being compassionate, being honest and authentic, and creating an environment where it is okay to not be okay is very helpful to people that might be struggling. I think this is a time for creativity. I think it's a time for innovation and acceptance and looking at things differently, and the opportunities for positive change management, because I do think there are some good things that have come out of this situation. And I would say more specifically around mental health, I would encourage you to look at the programs that you do have in place. I think this is a time to be bold, and I think this is a time to make sure that our most valued resource, our employees, who will in fact be the ones to get us through this, have the support that they need to be as resilient as possible to face the future that we have. So with that, I will pause and certainly open to any questions.
Thank you, Claire and Colin. Your perspective on describing the critical principles to help employees with their mental health amid COVID-19 is very insightful and appreciated. I do notice a few questions coming in the chat. Colin, are you able to speak? I have you, you're not muted.
So I see one question, which is about critical incident stress debriefing. I will say that part of our organization, the Mind Beacon Group, is actually a clinical setup, and that's actually where our roots began. CBT Associates is a multi-clinic network with a range of practitioners, including many, many psychologists who have a broad range of experience and expertise. So certainly beyond our support for employees and individuals through mental health therapy, we have an opportunity to support organizations in many other ways. And I would encourage you to reach out if you have some needs, and we can discuss that as well. I don't know, Patricia, I wasn't able to watch the chat, so I'm not sure if there's any other questions that you were able to see through the chat.
There was one question which I believe you you did answer in your presentation, but maybe you'd like to just speak to it again. And the question was, is Beacon currently cost-free in Ontario?
It is.
Mm-hmm.
It is. So it's part of that. It's a part of the Ontario government mental health supports. There's many things that they are offering. And we're very glad that Beacon is one of those things. We've always felt that a care continuum, a mental health care continuum, is best when it has many options to meet people where they want to be met, but also to offer stepped care. Because sometimes individuals may be intimidated by some approaches that they find more intrusive, and virtual or digital approaches can be really helpful in eliminating some of those barriers and allowing people to be more honest and open around their needs and around their therapy.
Thank you, Claire. I see Colin, I think he's having sound unable to speak to us. So in the chat, he has identified that 85% of people in the session identified as working from home that responded to the poll.
Yeah. Yeah, and I mean, that's amazing how I think people have adapted to that. I can say personally, I was quite resistant to the concept of working from home. In fact, as we made a decision, many in our company always worked virtually. We are available coast to coast to coast. And because we work with regulated clinicians, it means that we need to have clinicians across the country. So there was a big portion of our workforce that worked remotely. I will say that I've adapted quite well and can see the benefits. And I think, for many, working remotely is a benefit because if travel time takes up a meaningful part of the day, being able to reallocate that time to things that are more, to our personal life and to our families, that's a benefit. So I think that organizations are, as we talked about this morning, I think organizations will really be needing to consider their thoughts around it. Might mean that they have to look at new ways of engaging with employees or evaluating employees. But I think many have found it to be a very, very positive experience.
There's another question here for you, Claire. What would the process to engage Beacon look like for individuals?
So we're happy to speak to you. I think my contact information will be out there. If you're talking as part of an organization, we work with organizations and have a team that can discuss it in more detail with you. But no, we've been working quite closely with many of Canada's leading organizations, big and small. We work with very large enterprise organizations, and we work with smaller organizations as well. Everything from unionized government or unionized environments to white-collar professional groups, so very broad base of experience.
And kind of in sync to that question, there was a question asking, sorry, the chat bar continues to move as new chats come in, but do you need to have any specific identification to access your services?
So if we're talking about the Ontario government, can I assume that that's what the question is in relation to?
Yes.
Okay, so if it's in relation to that, no, it's free access to all. There's no barriers. You should be a resident of Ontario, and certainly if someone was to access Beacon, their first step would be to complete an assessment. It probably takes about 15 to 20 minutes. It's where we begin with our program. It's how we ensure that we can treat individuals effectively with our programs. We treat a very broad range of conditions. And we want to make sure that we are putting people in the right. We are working closely with government. If somebody was to arrive at our program and we've determined that they're not appropriate for Beacon, we work with the authority to support them in being triaged into the right care.
Excellent. And then one last question on there is, do you know at this time how long access will be free for Ontarians?
We don't know.
Okay. Excellent. I think we'll
with COVID.
Yeah, exactly, right? It's hard to say how long during the pandemic that will necessarily continue. The pandemic of COVID from the government and federal levels as well. So I want to, just in closing, thank you, Claire and Colin. Sorry, Colin, about some of the sound at your end, but I think we were able to get all the questions and polls responded to everybody. So thank you once again. Great information that you've shared with us.